it's a bad feeling.
He's going to have to do something.
It's real easy because all they do.
December 10th, I thought I was battling an infection, a form of mastitis, which is just an infection in the breast. I was taking antibiotics. I had been taking antibiotics for almost a month, and I'd already had a mammogram, which was perfectly normal. Had an ultrasound, which was perfectly normal. So the need for concern was gone as far as I was. I thought I just figured I needed to find the right antibiotic, and it would finally clear it up.
Hey, how you doing?
Doing fine. It's all quiet over here.
You getting along okay?
Doing pretty good. It was then that they decided to do the biopsy. And the biopsy was done, again, clearly thinking that it was an infection. The doctor had mentioned there was a rare form of breast cancer, that this could possibly be. And again, I still just dismissed it. It's just waiting for the right antibiotic. We talked about some steroids to help get the inflammation down. I had self-exams, my mammograms, everything I thought I was supposed to do to keep healthy. So no, this has been the shock of my life. Still a little surreal to me.
Dr. Waters says inflammatory breast cancer occurs when cancer cells form sheets of cancer instead of a mass like the typical cancer form. As the sheets grow, they invade the body through the lymphatic system. While less than 5% of breast cancer cases are inflammatory, it is extremely aggressive and is currently untreatable if not caught early.
Inflammatory cancer is a little different situation in that it is not unusual that you actually don't see the primary tumor. Because it's presenting with tumor cells plugging up these lymphatics, that's what they're looking for with the histology of those specimens. They're looking for tumor cells within these lymphatic channels, and it physically plugs them up.
Typical cases of inflammatory breast cancer begin with a reddish spot, some bruising and swelling of the breast and infected area. Other signs are a sunken nipple, general pain in the upper arm and underarm, and fatigue.
The classic presentation is a rock-hard, swollen breast with the skin takes on this appearance. It's been labeled peau d'orange, meaning orange skin, and it looks just like that. It's not that color, but the same texture. It's that firm, kind of shiny consistency. The pores in the skin become accentuated because there's so much swelling in between them. And it does. It looks very much like orange skin.
This is quite impressive to see. It gives me a better feel of I guess you could say I'm facing the enemy, so to speak.
At least you can see it pretty clearly.
Yeah, I can see it very clearly, especially with the side view.
It's very important to understand that MRI is generally not a screening tool for the breasts. Diagnostic mammography and screening mammography are the daily workhorse of imaging of the breast. They are what is used on everybody, and MRI should not be thought of as a replacement for screening mammography. All women should have annual screening mammography, and only women in specific circumstances should have breast MRI. What's nice in your particular case is that the left breast, best shown here, is really truly an example of what normal breast looks like in MRI. It should be this almost completely black ghost of a breast. By comparison, your right breast is dramatically different. Diffuse abnormal signal is seen throughout all of the breast tissue. Not only is it in the breast tissue, but there are also, as you can see right here, this small cluster of circles. Those are lymph nodes that are reacting to some process in the breast. Here's what a normal lymph node looks like. Here's what abnormal lymph nodes look like. So they're also an indicator that something dramatically different is going on in this breast.
many times the patient comes to us after they've had their mastectomy done. They've already had their primary surgery done. But again, with women who have more aggressive cancers or in particular inflammatory breast cancer, then you want those women need to be treated first and then have their mastectomy done or their primary surgery done.
Doctors advise with any new growth or discoloration on your body, you should monitor it and contact your doctor to keep track of the change. While Smith's cancer was only caught through breast MRI, the American Cancer Center says inflammatory breast cancer can be caught through normal examination procedures.
Even after the diagnosis of cancer, even after surgery for cancer, even after cure of cancer in the breast, typically there's another breast remaining. And that breast needs to continue to have the annual surveillance that detected the first cancer. And those patients should continue to have their annual screening mammography. And if necessary, if something shows up in the future, they may progress again to another breast MRI.